Come. Okay, so the first one to prevent chest complications, you know chest percussions, clapping and all,
Yes.
you already had in your cardio. Okay, so in ICU, what are all the tubes you can see? Tubes. What are all the tubes? Patient won't take because he had paralysis, no chewing, nothing. Okay, so how the patient will get food? How the patient will get food? Because he can't take food. Tube. What you will call that tube? Riles tube. What is that? Riles. R-Y-L-E-S. Riles tube. So this will be through nose. Okay, you can inject the food in a liquid form that will go directly into the stomach. So we will call that as Riles tube. Okay, so we can see Riles tube, and what are the other leads you can see in ICU? Riles tube, IV. What are the other things? Chest, ECG, ECG leads. Apart from that, anything else? Okay, so these are the leads we are having. Okay, now the first, to prevent the chest complication, the physiotherapist has to do chest percussions for every 2 hours or 3 hours. So how will you know, anyone knows how to do clapping and all? Clapping? Can anyone perform clapping? No? Why? Okay, so you know postural drainage? Oh, what do you mean by postural drainage? Because again I can't take all these things here because a lot of things has to be covered for stroke. Okay, if you can tell then it will be easy for me to go further. Okay, what do you mean by postural drainage? Postural drainage. For relieving the sputum, you will position the patient in different positions based on the lobe that is affected. Okay, but here you can't make the patient up and down because he already had a problem in the brain. You can't do all these things. Okay, so you can elevate the patient by using some pillows under, and you can, but you can't tilt the table. You should not tilt the table. You can, if you want to drain the sputum and all, you can lift, you can keep some pillow, and you can give percussions. And while giving percussions and all, okay, because he is already have a brain injury and all, don't make his head tilt back. What will happen? Again, blood will drain here, then again will compress the brain. Okay, so what you had in postural drainage, don't do the same way. Okay, the first thing is head should be neutral, it should not go back. Okay, whatever the position you have to alter, you can alter here, or you can go for side also, no problem. But don't alter the position of head, that is very, very important. Rest of the things, you can go for clapping. What are the other things you can do to get the secretions out? Yeah? Vibration. So how will you do vibration? Okay, so here the pressure should come from here. Okay, okay, pressure, vibration. Then you can go for shaking. Okay, lift the whole, do for shaking. Okay, so after shaking, okay, so first one is clapping, vibration, shaking. After this, how will you get this sputum? He is an unconscious patient. He can't. Huh? He is an unconscious patient. How can you expect him to cough? Yeah. So you will have a tracheostomy. So you can do a suction. By suctioning, you can get the secretions out. So this is first one to clear the chest complications. Now, if patient is conscious, and if he can do some Okay, if you can able to do some breathing and all, you can teach him some breathing exercises. Breathing exercise. Can you tell me what are the breathing exercises? Diaphragmatic breathing exercise. You know how to do that? Maybe in your cardio you know very well. Diaphragmatic. Deep breathing. Diaphragmatic breathing exercise. What are the other breathing exercises? What are the other breathing exercises?
From nose on.
Partial lip breathing. It's not for stroke. Partial lip breathing is for spinal cord injury patients. This is not for stroke. Stroke you can go for diaphragmatic breathing exercise, and also you can go for segmental breathing. You know segmental breathing?
Yes. Press on segment. Upgrade.
So you can go for apical segment, upper, lower, like that you can feel that patient can get the air in that particular segment, and again expiration. What is the ratio for inspiration and expiration? Ratio. How much time for inspiration, how much time for expiration? Generally. How much time? Let it be if it is on 4 minutes. How much time you will ask the patient for inspiration, and how much time you will ask the patient for expiration? Let it be it's in 4 minutes. So 1 minute is an inspiration and 2 to 3 minutes for expiration. Okay. So you want to give more time for expiration. Why? Because coughing is an expiration or an inspiration? It is a forced expiration. It is a forced expiration. So you want to train the patient for expiration, more expiration, so that sputum can come out. Okay. So the first one is, if the patient is unconscious, you have to give the percussions, and you have to get the secretions out with the clear the chest with suction. And if patient is good, give percussions and ask the person to get the secretions out using coughing and huffing. Or if he is good, having some to prevent the chest, to prevent getting the secretions, you can teach him some breathing exercises. And one more important thing here is, relax. The stroke patient, generally, the stroke patient, the one side is affected, no? Because of one side is affected, how the patient will definitely will do here is, he will lean to one side, because there is no tone, no power.
Yes.
It will be like this. Once if you get the patient to a sitting posture, even with the support, the patient will lean to like this, head will drop. Okay. So if this is the condition, if there is no Ryle's tube, if you give feeding like this, what will happen? If you give feeding like this in this position, what will happen? Where the food will go? The food will go directly into the lungs. The food will go directly. Whether ever tried keeping the head, have this. Will the food will go to your esophagus? No. It will go to your esophagus. It will go directly into your lungs. Okay. So what I am insisting here is, the position of the patient is very important while giving feeding. The position of the patient is very important. The head should be neutral. The trunk should be aligned properly, even if you are giving some support. It should not be lean to one side, head dropped. You should not feed the patient. Okay. So align the patient, get the head into a neutral, then you have to feed. This is very important. Why? Because lot of stroke patients are going more prone for pneumothorax. What is that? Pneumothorax. Pneumothorax means the food particle is entering inside the lungs, leading to an aspirated pneumothorax. What do you mean by aspiration? Aspiration means what? Getting food inside the lungs. Aspiration. Pneumothorax means infection for lungs. Okay. Definitely the patient will die within 2 days. How many days?
2 days.
After pneumothorax, even some patients will die Even if you add pneumothorax in the morning, he will die by evening. So that is the dangerous part. So as a physiotherapist, you must be very cautious. You must tell to the nurses and the caregivers while giving food, align the patient properly. The head should not drop and it should not be inclined to one side. So he has to position properly and then give the food. If unfortunately if the food enters, patient will have a aspirated pneumothorax. He will die within day or 2 days, definitely. Okay, so that is why these are the prevention of chest complications. Okay, what is the next one? So how will you prevent the pressure source? What do you mean by pressure source? Pressure source. Pressure. Come on, right. Huh?
Pressure.
Yeah, pressure. So here, if he is a patient, okay. So what is the problem here for hemiplegia? They don't have muscle power. They lost sensation. They are lost sensation. So there is no muscle power. There is no sensation. So what will happen here? Definitely patient won't move. He is immobile. He can't move. So what will happen? There is no sensation. If there is sensation, what will happen? They will try to turn the body. But they can't turn now. Oh, I should not touch there. Okay. So what will happen here? Because of loss of sensation, because of weakness, patient can't move. So what will happen? There is pressure between the bed and his skin, underlying skin. So what will happen? Because of more time for more pressure. Okay, so what will happen? They will form some wound. So that is what? Pressure sore. How to prevent this? Very good. For how much time? Every 2 hours. That's okay. Okay? In acute stage, every 2 hours. Okay. Next. What are the other things? One is changing the position.
The bed must be soft. Under body.
So now the bed should not be hard. That is what you mean to that. So what type of bed is preferable?
Soft bed.
Yeah, that's good. Water bed, air bed. 2 things. Water bed and air bed. Okay, so water bed and all won't give much pressure for the underlying skin. So preferable is water bed and air bed. Generally, if you go wherever in the hospitals in neuro rehabilitation unit or where there is patients for long time, first one is they will prefer water bed or air bed. Okay, so that is one thing. Even if you are prescribing water bed and all, air bed, there is chance of having a pressure source. The major important thing here is for every 2 hours you want to change the position. So now he is a stroke patient. So how to rotate him? You can't rotate like just pulling him. Okay. So here there are so many problems in relates to the stroke where let it be his left side is affected. His left side is affected. So how to turn him? How to turn him? So the whole side is paralyzed now. You have to give support. Okay, you have to give support. If you are not giving support, first and foremost thing is the shoulder will get dislocated. Okay, so how to turn the patient? So first to get the bed to a neutral. Okay, make it neutral. Then bend the leg which is affected. There are so many ways. I am just showing one of the way. That's all. It all depends upon how the patient okay, is present at that particular time. Okay, then you no need to touch anywhere. You can just, okay, if you turn this part of the body, automatically it will be, okay. Then after this, holding here, the important thing here is you want to give support for the shoulder. Okay, so have a hand over the scapula. Over the scapula, hold here. Okay, then slowly turn to one side. Okay, then slowly turn to one side. Okay, now what I have done is rolling or turning. What is this? Whether it is rolling or turning. What is the difference between rolling and turning?
This is third.
Huh?
This is third.
Okay, now I am asking him, now turn to this side. What he is doing now?
Rolling.
No. What he has done? Yeah.
Change position.
Yeah. No, it's not changing. Can you go once again? Now, I am showing first rolling. I am just showing rolling first. This is rolling. If I do rolling, if I train him for rolling, definitely next day he will be on floor. Next day he will be on floor. What he needs here is turning. Turning. Now, he will do turning. Come on. Now you do it. See what he is doing now? He slided his pelvis backwards. He slided his pelvis backwards. Then he is in safe. This is what? Turning. So one of the important treatment technique where you want to teach the patient is turning. If you are not teaching turning for him, definitely he will be on floor next day. Sir, I have teach him rolling. That rolling will make him to fall down. So keep it in your mind. I will show you how to train a patient for turning in, okay, next. Okay. So now here, for that is how you can now change the position of the patient. Okay. So for rolling, just I am telling for rolling. So okay, turning this and hold this. Okay, give support for the scapula and just roll him to one side. Later you can adjust the patient. Okay, it's not so easy. Okay, you need someone's help. Okay, otherwise you have to hold their buttocks and you have to pull them back. Okay, so this is the always support the shoulder. I am very insisting you because lot of stroke people after the acute stage, lot of people will complain of shoulder pain. Why? Because lot of people what they will do here is, if you want to turn the patient, they will pull and they will turn like that. Okay, or one more common problem here is, see, this is a paralyzed one. You are turning here, but the hand is there only. What will happen? The whole structures will get stretched. Okay, and they will get injured. The structures will get injured. This is not the right position to be there. You has to be here. Okay, so a lot of people will neglect that. So what will happen? That will get, shoulder will get affected. Trauma for shoulder. Structures in and around. What are the structures around the shoulder? Shoulder. Structures. I am asking just structures. I don't want any muscles. First come from bone. After bone, what is the next one? Ligaments. Capsule. After that, muscles. What are the muscles now? Rotator cuff muscles. Now here what will happen if you are not taking care? The capsule will stretch. The capsule will stretch. And also one more important problem here is this. This scapula, okay, there is no muscle power. The scapula will go down and humerus will go and impairment. What is that? Impairment. You might have in your ortho. Shoulder impairment syndrome. What is that? Shoulder impairment syndrome, where scapula and the humor will get impaired. So what is the muscle that is going to be affected there? What muscle? Scapula, that is acromion process here now. What is the muscle? Supraspinatus. So that supraspinatus is going to be affected and patient will complain of pain. Okay, so to avoid all this thing, what is the important thing? Hold the hand, give support,